Hi, I'm Femi OK. Today on the stream, we are taking you behind the headlines of the COVID-19 crisis in India so you can ask questions. We have assembled a team of experts and you can literally ask them anything about the global pandemic and how it's playing out in India. Let's meet the guests. Hello, Dr. Kaka. Hello, Dr. Soin. Hello, Anu. It is good to have you here on the stream. Dr. Kaka, will you remind our stream audience who you are and what you do?
Hi Femi, I'm Dr. Kamna Kakkar and I'm working as a senior resident in a critical care unit in a tertiary care center in Haryana, India. I've been a frontliner for last one whole year and I've been handling severe patients of COVID-19.
Thank you for joining us again. Ripped from the front lines of COVID-19 in India, we have Dr. Soin. Dr. Soin, please introduce yourself. Welcome to the stream.
Thank you, Femi. I'm Dr. Arvinder Soin, chairman of the Medanta Institute of Liver Transplantation, Gurgaon, Delhi. Apart from doing liver transplants, I have been a part of several research groups in the COVID pandemic and have led one important national study in India.
Thank you so much for joining us. And Anu, it's good to see you. Introduce yourself to our international audience.
Hi, my name is Anu. I'm a journalist in Delhi at India Spend, and I've been covering this pandemic. It's the second year of covering COVID-19.
Welcome. So you have met our experts. You can ask them anything. If you are on YouTube, make use of the comment section and be part of today's discussion and part of today's Q&A. Let me start with you, Dr. Kaka. The last time we spoke to you on the stream, we said, how is it? How is the second wave going in India? Fast forward to today, what would you say?
The second wave in India has been catastrophic, if you ask me. During the first wave, we had around 100,000 cases a day, but now in the current wave, we are having about 400,000 cases a day. So you can imagine the level of devastation that is engulfing our country. We're seeing too many deaths that we could have avoided, and it's basically a mess right now.
Dr. Soin, I am on your Twitter feed and it is a joy to behold in terms of giving out information. Your medical service is far beyond just taking care of patients. You are there answering questions. I wish I could answer all DMs and questions, but running a hectic clinical schedule. I am so glad that you're here with us right now. What is the most popular question you are being asked right now?
I mean, there's no one question that I can pinpoint. There's several questions that everybody is asking me. I think the most common query is when they test positive for COVID, they all go into a state of panic. So they want to know what to do at home, when to call a doctor, when to head for a hospital. So these are basically the theme of the common queries that I'm getting. Mm-hmm. So we obviously have a protocol for home management. And what I tell them is to connect with a good COVID physician. And there are several COVID physicians all across the country in every hospital. And all the physicians who do not normally practice internal medicine or pulmonary medicine have also pivoted and now started advising people about COVID because every hospital has fixed COVID protocols. So the online teams that are answering people's queries and in fact, helping them through mild COVID at home has really gone 100-fold compared to last year. So we have set protocols. We advise them on the protocols. We tell them when to, what warning signs to look for, when to head for a hospital, and so on. The other common question relates to vaccination. So a lot of people are asking us, if I'm on blood thinners, can I have the vaccine? If I had the first vaccine, then I had a mild infection. Right. When do I take my second shot? And so on. They revolve around vaccination quite a lot.
All right. So Dr. Soin, you can't ask all those questions without giving us the answers immediately. Go ahead. Blood thinners.
So the simple dictum on blood thinners is that everybody should get the vaccine, even if they are on blood thinners. If they're running a particularly high level of blood thinners, then consult your cardiologist or a vascular doctor or the internal physician who's taking care of you. You might want to stop those for 3 or 4 days and then take the jab. But for more than 95% of the people on blood thinners, which include antiplatelet drugs and regular doses of anticoagulants, you can go right ahead and take vaccination.
Okay.
So
All
that's
right.
a straight answer for that.
All right, appreciate that. All right, Anu, I want to show you something here. This is here on my laptop, and this is what the string put out a little bit earlier. A second wave of coronavirus is overwhelming health facilities and crematoriums. What questions do you have about COVID in India? And I'm just going to go down to Usman. Usman asks, why can't they lock down the country? And wondering if you lock down the movement, stop social gathering, maybe that will help the second wave. Anu, what have you been reporting on that idea of a lockdown?
A couple of weeks ago, I did write a story about why a second lockdown would be a bad idea. And I think, we were not seeing case numbers like this at that time, and experts did feel that a lockdown would be excessive. I think, unfortunately, we've now reached a situation where our health facilities are so overwhelmed that a lockdown has now become incumbent. India did have a lockdown last year, which was a brutal lockdown, and it triggered a humanitarian crisis with millions of people walking out on the streets and trying to get home. We are currently facing a lockdown. It's just that it's different from last year. So last year's was a nationwide lockdown, and what we currently have, I live in Delhi, which is the capital of the country. So we're having a sort of regulated lockdown in different parts of the country where different governments, state governments are taking that call on their own. So there isn't a nationwide lockdown, but yes, I mean, we do have a lockdown in different parts of the country, which now just has to happen because health facilities are overwhelmed.
Dr. Kaka, I saw you nodding there.
But Anu, don't you think? Can I just come in here?
Sure, of course.
So don't you think we are like a mini world in ourselves? I mean, we are such a large population. We are a huge country. We have so many states. We are like several countries together. And therefore,
absolutely,
obviously, the regional lockdown that's happening in different parts of the country, and more states are following, is going to be necessary to break the chain of transmission, to give a breather to the healthcare workers, to give a breather to the supply chain of essentials, to the oxygen supplies, and get them all together to order some vaccine, ramp up the vaccination drive. So obviously, a lockdown, nobody likes a lockdown. But we are inevitably heading towards, if not a national lockdown, a sequential lockdown of the country. And we have seen that in Delhi and Bombay, the lockdowns have started working. The numbers are actually coming down in these two cities, but they're going up elsewhere. What do you think, Anu?
Yeah, I mean, when a lockdown, the thing is, people like me, perhaps, we have this privilege of ordering food home and working from home, and a lockdown is okay for me. But this country is not comprised mostly of people like me. It's comprised of people who actually do need to, do physical labor and need to be out on the street.
If they don't go out to work, they're going to starve. So there was a humanitarian crisis with the first lockdown. So I do understand what the problem is with another lockdown. I'm going to push us on a little bit because I have so many questions. YouTube, thank you for your patience. This is Andita Goshal. She says, please can you explain about black fungus? Dr. Kaka, is that something that you want to pick up on? Because that is going around online a lot. Hashtag black fungus means what?
So in black fungus, we are seeing a case in which people, they present with mucormycosis. That's the name of the disease that has been termed as black fungus. So patients who are on steroids or patients who are immunocompromised or say they are diabetic and on steroids. So these are the kind of patients who are more susceptible to superadded infections, which may be bacterial infections, which may be fungal infections. So this is something that's going around in Maharashtra and in places where we saw the second wave rise early. Even in Delhi, we're seeing a few cases. People are coming up with pain in around their eye region, around their orbits, in the forehead. So these are the patients who are treated with amphotericin B and medicines which are antifungal medicines, and who are more susceptible? Patients who are immunocompromised, patients who are diabetics. So these are the kind of patients who need to be very careful with the amount of steroids they're taking, when they start with steroids and when they stop the steroids. a lot of people I know who are taking steroids for mild disease. This is something that's not recommended anywhere. People are just popping steroids like, like it's candy. This is something that's not recommended anywhere in the world, and I would suggest anybody who's watching this video to not take steroids if it's not indicated by a doctor or somebody who's actually treating your case. Do not start steroids on your own. Always consult a doctor.
So what I'm showing here on my screen is a tweet, and it's also on your Instagram post about what black fungus is, Dr. Soin, and then people, like your ideas, and exactly echoing Dr. Kaka about when you should use steroids, when you shouldn't, and the complications that happen from that and the cause of black fungus. So that is there. So you can go to Dr. Arvinder Singh Soin's Instagram or also his Twitter, and you'll find out that information there. It is potentially deadly. I want to move on to a topic that a lot of you are talking about online in YouTube, and that is vaccines. Let's start with this comment first of all. Go ahead.
Now that everyone knows what are the symptoms of COVID-19 and how it spreads, they are worried and want to know more about the long-term complications of the disease on the body. And as far as vaccination is concerned, the most common question that we are facing right now from people is, can a person with hematological disorder take the vaccine or not? Diseases like ITP, thalassemia, sickle cell anemia, etc. So what I would like to tell them is there is no reason to worry. There is no absolute contraindication for you. If you are eligible, 18 plus and have access to vaccine, just take it and stay safe.
Doctors, so many questions about vaccines. Rajiv is on YouTube right now. Rajiv says, hello everyone. I've been trying to register for a jab, but I can't get one. I fall into the category of 18 to 44 years old. It's hard to do this. What is the problem, Dr. Soin, with people who are ready to get a vaccine in India, but they can't get one?
Femi, it's no secret that we are falling woefully short of the vaccines that we actually need. We have a huge shortage. We grossly miscalculated the number of vaccines we're going to need, or rather how long they would take to deliver, and we would have to administer them in a few months. So as things stand now, we've only administered about nearly 200 million doses, whereas we need to administer 1.2 billion doses if we want to get anywhere near the levels that Israel or UK are at the moment. And they're being able to see the end of the pandemic, at least for now. So to get over this, you need to vaccinate at least 50 or 60% of your population, and that's when the numbers, COVID numbers, will start to decline. So we are falling short of vaccines. Now, what's being done about the vaccines is something that I'd like to discuss here. And I've tweeted for several days on the shortage of vaccines and what we need to do, how we need to vaccinate about 1 billion more. With billion more doses in the next 6 months. Where does that 6 months come from? We're in the midst of the second wave, which is peaking now, hopefully plateauing out. And going by the experience of the rest of the world, we probably have between 4 and 6 months before we get the third wave. And these are the 4 or 6 months that we have to use to vaccinate rapidly. Having said that, where are the vaccines where are the vaccines going to come from? Sorry.
Yeah, I was just going to add on the same point. I mean, in India, there are 2 vaccines that are approved, 3, but only 2 that are currently being used. And both of these are vaccines that are being made in India. So to Dr. Arvinder's point, where are the vaccines going to come from? They're actually being made in India. It's a total shame and pity that, it's not like vaccines are having to be flown into the country from elsewhere, but we've just miscalculated. And I don't know how we can miscalculate. We knew how many people we have in this country and how many people are going to need the vaccine, but policymakers just didn't count the number of vaccines.
What a terrible
the number of people
irony, Anu. What a terrible irony for India, making vaccines,
let me
sending
go
overseas.
Dr.
Soin, if I may, because I've got more questions, if I may, because we're trying to do the questions. I'm making you available for our audience. This is Ashish Mishra. Dr. Kaka, have a listen to Ashish's question and then come off the back with an answer. Here we go.
What if people take the vaccine when they are corona positive, but they are asymptomatic, so they never get tested, and somehow they took the vaccine? How it will affect? Or maybe they were positive and asymptomatic, they never get tested, and after recovery within 6 days or 7 days or maybe a week they took the vaccine. How it will be affected on their bodies? Is there any side effect or anything? which could be harmful to the body.
That's a very interesting question that I just got. And according to me, I think this shouldn't ever create a problem, because the effect the vaccine has on the body and the effect that COVID has on the body is to create immunity. And you're getting immunity from any means, by getting the infection itself or by getting a less severe infection from the vaccine. So it's like it won't hurt you in any manner. You can safely go for vaccine, regardless of whatever symptoms or asymptomatic you may be, you can go for the vaccine.
Dr. Sewing, pick up on that, because people are also asking on YouTube, what is the best vaccine to even have? Is there an option?
No, look, so we have two vaccines in India, Covaxin and Covishield. Both have been shown to be effective in producing antibodies 2 weeks after the second shot. So the first shot is given on day 0. For Covishield, you have to wait 6 to 12 weeks before you get the second shot. And for Covaxin, you have to wait 4 weeks. And 2 weeks after the second shot, you have protection against COVID. Now, you still may get mild infection after vaccination, and there have been many breakthrough infections, as we call them. But the vaccines prevent severe disease and death. That is something that's a fact that is universal across the world, in India and elsewhere, with all the approved vaccines, right? Now, I'd like to also qualify the statement that Kamna just made. If you don't know that you have COVID and you have asymptomatic COVID and you go ahead and get the vaccine, there will be no problem. But if you do have COVID, and if you have the fever and cough, it is actually recommended that you recover from that. And if it's been mild, then 15 days after recovery, you can have your vaccination. But if it's been moderate or severe COVID, then you have to wait a month before you go ahead and get vaccinated. In fact, with the mRNA vaccines in the US, the CDC recommends waiting 90 days before you go ahead and get your vaccine after the infection. But for Indian vaccines, the recommendation is between 15 and 30 days, depending on how severe the COVID infection has been.
I am thinking, Anu, of the big headlines that have been coming out of India in the past 2 weeks. 1, hospitals being overwhelmed. 2, vaccines not being available from the pharmacy of the world, which is India. And 3, worry about variants. This is where I want to pick up with the next video, because Kritika has a question about the variants. Have a listen and then share what you know about variants.
The biggest question that the public is facing, and we are all finding answers for, is how is this virus virulence is going to change over time, and what are the potential risks of these mutations and change in the virulence factor?
Honestly, Femi, I think that's a question for the clinicians on the program. The WHO has just said today that the variant in India, they are now classifying it as a variant of concern and not just a variant of interest. So this means that India's sort of risk status has been upgraded, honestly, just today, just a couple of hours ago. But the specific technicalities, I pass it on to the experts on the panel.
Can I take that?
Of course.
Let me take that.
Yeah, of course.
So there's a paper published in Clinical Infectious Diseases just 2 days ago, which shows that in the laboratory, the Covaxin was effective against the Indian variant, which is the B1.617, right? So in the laboratory, we saw that it was effective. The real world experience is still not being generated because we haven't done enough genomic testing of patients that have been followed longitudinally after vaccination. But we are hoping that the vaccination, 2 doses of the vaccination, will prevent severe disease and death even among the variants. This is, like I said, has been seen with the other vaccines in the rest of the world, including with South African and UK variant. And we are hoping and praying that even with the Indian variant, 2 doses of vaccine should be okay. I mean, even this time, we haven't had that many severe diseases and deaths among patients who've been vaccinated, even when they've had COVID
I'd like
afterwards.
to add on to something that even if even if there are multitudes of variants going around, the mask would protect you from any kind of variant. The mask would protect you from any kind of mutations. So rather than worry about variants going around, rather than worry about mutations going around, you should be focused on COVID appropriate behavior. You should wear your mask, you should use sanitizers wherever possible, and just relax, because vaccine will protect you, mask will protect you.
Anu, you shared your question with the doctors because variants is not just a news story, but also is a science story. But I'm going to give this one to you, and the doctors will not want to answer this one. This is from Sadhanshu, and Sadhanshu says, I really want to ask about the arrogance of our Prime Minister. It has destroyed us. There's a lot of complaining on the YouTube comments about Prime Minister Modi because of the way he has handled this entire situation with a second wave in India. As a reporter, how is that being played out in India?
Yeah, I'll absolutely answer this. There's good reason perhaps why the doctors may not be able to, but they need to do their job. We have a prime minister. This is the second term that he's the prime minister, and he's won with an overwhelming majority. So he's an important man. And I have wondered as a reporter, watching several broadcasts that he has made to the nation, why on any of these broadcasts he wouldn't have used that amazing time that he has with a whole country wrapped around his finger, why he didn't use that time more effectively to just tell us the kind of things that we need to tell us. You know, he's a prime minister who speaks in Hindi. Hindi is a language that's spoken by a large majority of this country. Just speak to people in the language they understand. You know, there's so much of awe and adulation for this prime minister. Just tell people the kind of things they need to hear. This is also a government that likes to brag. And as a journalist closely tracking statements from this government, watching their press releases, they have bragged. But, you know, the evidence right now does not allow for any more bragging. And, you know, my sense is, though, that, and I tweeted, I took a risk and I tweeted this some time ago. I said, if there's an election today, this government will still win again. I do believe that because there are a number of reasons why there is love for this government and this prime minister. But, you know, I think everybody, whether you support this government or you don't, whether you have had your business prosper or you haven't, everybody has lost someone this pandemic, and that will impact at some level the next time we go to vote.
So we have so many questions on our YouTube comment section. Thank you, everybody, for taking part in this program. It really shows how much the information is needed, and our experts have done an excellent job. One of the things they haven't done, though, is they're taking care of you. I'm wondering who's taking care of them. Dr. Kaka, how are medical professionals doing? How are they coping? The scenes that we've seen in the last few weeks are excruciating. How is your mental health? How are your colleagues' mental health?
Well, I know a lot of people around me who are on antidepressants right now, who are taking anti-anxiety tablets, who are on therapy right now. A lot of my colleagues, they just want to resign. They just want to get out of medicine as a career, as a whole. We are hanging by a thread. We're all burnt out. We are overworked, and it's really hard to put into words how you know, young doctors, interns, junior residents, senior residents, they've put in their whole during this last one whole year. And even now, the pandemic doesn't seem to end. We're just witnessing so much misery, we're witnessing so much deaths. We were never prepared for this. Never prepared for this.
Kamna, don't you go to work every morning? Why do you go to work? Why do you go to work?
I don't know, but it's just...
You go to work because you still have that zeal inside you to save lives. I think that is what is driving us. So while what you said is absolutely true, we are all at the end of our tether. We are all, obviously, we want out of this. But I think that the morale and the spirit of the healthcare workers is still pretty high. And, you know, they may be suffering on the personal front, but on the professional front, I don't think there's any let up at all. Everybody has risen to the occasion. I think partly because we are emboldened by the fact that we are all vaccinated, or most of us are. You know, for example, I had my second bout of COVID starting about 3.5 weeks ago.
Oh my
I had
goodness.
symptoms for about 5. Yeah, I had symptoms for about 5 days, but luckily after that I was okay. And through the 15 days that I was isolated, I was doing about 20 to 25 consults
Dr.
online
Soin,
every day.
Dr. Soin and Dr.
Yes.
Kaka, we salute you. Thank you for your service in India and for us here on the stream. I'm going to leave it there. Anu, Dr. Soin, Kaka, thank you very much for being part of the stream today. And YouTube, thank you for your questions. We appreciate them. Take care, everybody. See you next time.